Let's talk about something that millions of men quietly wonder about but rarely discuss openly: penis size. From advertisements promising dramatic growth to internet forums filled with secret techniques, the message out there can be confusing, overwhelming, and often misleading. Many men worry that they are not big enough, and some even believe that their sexual satisfaction or their partner's satisfaction depends entirely on size. But here's the truth. Most of what you see online about penis enlargement is not supported by real science. So today, let's break this down clearly, honestly, and scientifically. What actually determines penis size? Are enlargement methods real or just marketing hype? And most importantly, what does medical research actually say about increasing penile length? First, it's important to understand what is considered normal. Large medical studies looking at thousands of men have found that the average erect penis length is about 5 to 5.5 inches, roughly 12-14 cm. What's fascinating is that many men who believe they are too small are actually completely within the normal range. Have you ever wondered if what you think is normal is actually true? Many men spend years quietly worrying about their penis size, comparing themselves to unrealistic images they see online, in movies, or in advertisements. That worry often starts with a simple thought: am I normal? But here, the surprising reality that most people don't talk about. Asterisk, the majority of men who believe they are too small are actually completely within the normal range. Large scientific studies involving thousands of men from different parts of the world have carefully measured penile size to understand what is truly average. The results are incredibly consistent. When erect, the average penis length falls roughly between 5 to 5.5 inches, and most men fall somewhere close to that range. Yet surveys repeatedly show that many men assume the average size is much larger than it really is. Why does this happen? Because the images people see online or in adult entertainment are not representative of the average person. Those performers are often specifically selected for extreme physical traits, and what you see there is not a realistic sample of the population. This misunderstanding creates a powerful psychological effect. When someone believes the normal standard is much higher than it actually is, it can create unnecessary anxiety and self-doubt. A man who is completely average may still feel inadequate simply because his expectations were shaped by unrealistic comparisons. Over time, that belief can affect confidence, body image, and even relationships. Here's another surprising insight from research. When partners are asked about what matters most for sexual satisfaction, asterisk size is rarely at the top of the list asterisk. Many studies have shown that factors like emotional connection, communication, trust, and overall intimacy play a much larger role in satisfaction than physical measurements alone. Yet the cultural narrative often pushes the idea that size determines everything, which simply does not match what science and real-world data show. Another important point is that penis size varies naturally, just like height, hand size, or foot size. Human bodies are not designed to be identical. Some variation is completely normal and expected. In fact, the vast majority of men fall within a relatively narrow range when erect, which means extreme differences are far less common than people imagine. What feels small to one person may actually be perfectly typical from a medical perspective. There's also a phenomenon known as asterisk perception bias asterisk. Because of the angle from which people see their own body, the penis can appear smaller when looking down compared to seeing someone else from a different perspective. This simple visual effect can make someone underestimate their own size without realizing it. Understanding these facts can be incredibly empowering. Instead of relying on myths, exaggerated claims, or unrealistic comparisons, looking at real scientific data helps put things into perspective. When men realize that the average size is far more modest than what media portrays, many begin to see that their concerns were based on distorted expectations rather than reality. What if the biggest promise you've heard about penis enlargement is actually the biggest myth? Every day, men are exposed to bold advertisements claiming that a simple pill, cream, or herbal supplement can dramatically increase penis size in just weeks. The promises sound tempting, Gain inches naturally, doctor-approved formula, or scientifically proven growth. But here's the critical question that very few people stop to ask. Asterisk, where is the real scientific proof behind these claims? The reality is that the market for penis enlargement products is a multi-billion-dollar industry and it thrives on one powerful emotion: insecurity. When someone feels uncertain about their body, they may become more willing to believe quick fixes and miracle solutions. Marketers know this, and many advertisements are carefully designed to look scientific, often using medical-sounding language, stock photos of doctors, or fake testimonials to build trust. But when researchers actually investigate these products, the evidence simply isn't there. Let's start with pills and supplements. Many of these products claim to contain natural ingredients that supposedly stimulate tissue growth or increase blood flow to the penis. Ingredients like ginseng, maca root, L-arginine, or various herbal extracts are often listed on the label. While some of these substances may have mild effects on energy levels or circulation, there is no credible scientific evidence showing that they can permanently increase penile length or size asterisk. Biological tissue in the penis does not grow in the same way muscles do with exercise, and taking supplements cannot trigger that kind of permanent enlargement. Another major concern with supplements is regulation. In many countries, dietary supplements are not tested as strictly as prescription medications . This means the ingredients listed on the label may not always match what is actually inside the product. Some investigations have even found hidden prescription drugs or unapproved chemicals in certain sexual enhancement supplements. That creates potential health risks, especially for people who may have underlying medical conditions or who are taking other medications. Creams and topical oils are another popular category of products. These are often marketed as fast-acting solutions that can be applied directly to the skin to stimulate growth. The idea sounds appealing: simply apply the cream and watch the results appear. But from a biological standpoint, this claim doesn't make sense. The skin acts as a protective barrier, and while some substances can be absorbed through it, there is no known topical ingredient that can trigger permanent growth of penile tissue . Then there are devices and gadgets sold online that promise dramatic changes with minimal effort. Many of these products are heavily promoted with dramatic before and after photos, which are often misleading or digitally altered. The marketing may include phrases like clinically tested or doctor recommended, but when researchers look for actual peer-reviewed studies supporting those claims, they usually find none. Another powerful hook used in advertising is the idea of secrecy and exclusivity. Some products claim to reveal a hidden method doctors don't want you to know about, or a breakthrough discovery banned by the medical industry. These statements are designed to create curiosity and urgency, making people feel like they've discovered a special secret. In reality, legitimate medical treatments are based on open scientific research, published studies, and transparent evidence, not hidden formulas or secret tricks. Understanding how these marketing strategies work can help people recognize the difference between evidence-based medicine and commercial hype . When a claim sounds too good to be true, especially when it promises dramatic physical changes with little effort, it often is. What if the biggest factor in sexual satisfaction isn't something you can measure with a ruler? For many men, the conversation around sex often circles back to one question: does size matter the most? It's a belief that has been repeated so often in media, jokes, and online discussions that it starts to feel like an unquestionable truth. But when scientists and relationship researchers actually study what creates fulfilling sexual experiences, the results tell a very different story. Many people are surprised to learn that sexual satisfaction is rarely determined by physical measurements alone. In fact, when couples are asked about what truly makes intimacy enjoyable and meaningful, the answers almost always focus on things that have nothing to do with size. Emotional connection, comfort with a partner, communication about desires, and mutual understanding consistently rank among the most important factors. These elements create an environment where both partners feel relaxed, confident, and engaged, which naturally improves the overall experience. Think about this for a moment. If physical size were the only thing that mattered, then every relationship with a larger partner would automatically lead to perfect satisfaction. But real life clearly doesn't work that way. Relationships thrive when there is trust, openness, and genuine connection between partners. When people feel emotionally safe and valued, they are more likely to communicate honestly about what they enjoy, what they want to try, and what helps them feel closer during intimacy. Another fascinating finding from sexual health research is the role of confidence. Confidence can significantly influence how someone approaches intimacy. When a person feels comfortable with their body and believes in their ability to satisfy a partner, that confidence often translates into better communication, better attentiveness, and a more relaxed atmosphere. On the other hand, when someone is constantly worried about their body or comparing themselves to unrealistic standards, that anxiety can create tension that affects the entire experience. Communication is another powerful piece of the puzzle. Many couples assume their partner automatically knows what feels good or what they want, but in reality, open conversations about preferences and comfort levels can dramatically improve sexual satisfaction. Talking honestly about what each person enjoys helps both partners feel heard and understood. It also allows couples to explore intimacy in ways that are mutually fulfilling rather than relying on assumptions or stereotypes. There's also the important factor of asterisk technique and understanding anatomy asterisk. Sexual pleasure involves complex interactions between nerves, muscles, emotions, and psychological comfort. People who take the time to learn about their partner's body, understand different forms of stimulation, and pay attention to feedback often create much more satisfying experiences. This kind of attentiveness cannot be replaced by physical measurements alone. Another element that research highlights is the role of emotional intimacy outside the bedroom. The way partners communicate during everyday life, showing appreciation, respect, affection, and support, can strongly influence how connected they feel during intimate moments. When couples maintain emotional closeness, their sexual experiences often become a natural extension of that connection rather than a performance driven by pressure or expectations. The idea that sexual satisfaction depends mainly on size is a simplified narrative that ignores the complexity of human relationships. Real intimacy involves communication, emotional awareness, curiosity about a partner's needs, and a willingness to learn and grow together. These factors shape the experience far more powerfully than a single physical measurement ever could. What if one of the only scientifically studied methods for increasing penile length requires something most people aren't prepared for: patience, discipline, and months of consistent effort? While the internet is full of promises about instant enlargement and dramatic results in just a few weeks, the few medical approaches that have been researched tell a very different story. They show that if any change happens at all, it tends to be slow, modest, and highly dependent on long-term consistency. One method that researchers have studied is the use of penile traction devices, sometimes called stretchers or extenders. These devices work on a simple mechanical principle, applying gentle, continuous stretching force to the penis over long periods of time. The idea behind this approach is based on a biological concept known as tissue remodeling. In certain parts of the body, when tissues are exposed to gradual and sustained tension, they may adapt slightly over time. This principle is used in other medical treatments, such as limb lengthening procedures or orthodontic braces that slowly shift teeth into new positions. But here's the important part that many advertisements leave out. The process is slow and demanding. In clinical studies, participants were often asked to wear traction devices for several hours per day, sometimes ranging from 3 to 6 hours daily, for a period of several months. Only after this extended period did researchers observe small changes in length, often around 1 centimeter or slightly more. For many people, that level of commitment can be extremely difficult to maintain in daily life. Another factor that is rarely mentioned is that results can vary widely between individuals. Some men may see minor improvements, while others may notice very little change despite consistent use. Human tissues respond differently depending on factors such as age, genetics, tissue elasticity, and overall health. Because of this variability, traction therapy cannot guarantee the same outcome for everyone. Comfort and practicality also play a role. Wearing a traction device for multiple hours each day can feel inconvenient or uncomfortable for many users. It requires planning around work schedules, daily activities, and personal routines. The commitment involved is far greater than what most marketing materials suggest when they advertise simple enlargement solutions. Safety is another important consideration. When used improperly or with excessive tension, traction devices may cause irritation, discomfort, or injury. That's why medical professionals typically recommend using only devices that have been clinically evaluated and following clear instructions on safe usage. Gradual tension and proper breaks are essential to avoid potential complications. It's also worth noting that traction therapy has sometimes been used in specific medical situations, such as helping restore length after certain surgeries or treating conditions like Peyronie's disease, where scar tissue causes curvature of the penis. In these medical contexts, traction devices may serve a therapeutic purpose under professional guidance. However, even in these situations, the expectation is gradual improvement rather than dramatic transformation. The body adapts slowly, and meaningful changes require persistence over long periods of time. Understanding the reality behind traction devices highlights an important lesson. When it comes to physical changes in the body, science rarely offers instant solutions. Real biological adaptation takes time, consistency, and realistic expectations. What if the pursuit of a larger penis could actually put your health at risk? It's a question that many people don't consider when they first come across advertisements promising permanent enlargement through surgical procedures or advanced medical treatments. The idea of a quick medical solution can sound appealing, especially when it's presented as a simple procedure with dramatic results. But when you look closely at the medical reality, the story becomes far more complex. Penile enlargement surgery is one of the most talked about medical options. One of the most common procedures involves cutting the suspensory ligament a structure that attaches the penis to the pubic bone. This ligament helps support the penis and holds part of it inside the body. By cutting it, surgeons allow more of the internal portion of the penis to extend outward, which can make the penis appear longer when flaccid. At first glance, that may sound like a significant improvement, but there are several important details that often get overlooked. The increase typically affects flaccid length not necessarily the length when erect. That means the visible change many patients expect during erection may not occur in the way they imagine. In some cases, the erection may even appear less stable because the ligament that once helped support it has been altered. Another important consideration is the potential for scarring and cosmetic dissatisfaction. Like any surgical procedure, the body heals by forming scar tissue. Sometimes this scar tissue can affect the appearance of the penis, creating uneven contours or changes in the way the skin moves. In some cases, patients may feel that the final result does not match their expectations, which can lead to frustration or regret. Then there are procedures designed to increase girth or thickness. Some clinics offer injections of substances, such as fat from the patient's own body or fillers like hyaluronic acid. These injections may temporarily increase the circumference of the penis, but they also come with risks. The injected material may not always distribute evenly, which can lead to lumps, irregular shapes, or asymmetry. Over time, the body may also reabsorb some of the material, meaning the effect might gradually diminish. In more serious cases, complications such as infection, inflammation, or tissue damage can occur. Because the penis contains delicate blood vessels and nerves, Any invasive procedure carries the possibility of affecting sensation or blood flow. Although severe complications are not extremely common when procedures are performed by experienced specialists, the risks are still real and must be considered carefully. Another factor that surprises many people is that most medical organizations do not recommend penile enlargement surgery for men who have normal anatomy ***. These procedures are usually reserved for very specific medical conditions, such as ***micropenis***, which is a rare condition where the penis is significantly smaller than the normal range due to hormonal or developmental factors. For men with average anatomy, the potential risks often outweigh the benefits. Medical professionals typically emphasize that the expected changes in size are relatively modest compared to the level of risk involved in surgery. When people hear the word surgery, it can create the impression that the results will be precise, predictable, and dramatic. In reality, surgical procedures always involve uncertainty, healing time, and the possibility that outcomes may vary from person to person. What if the most powerful change you could make in your sexual life has nothing to do with changing your body at all? Many men spend years focusing on physical measurements, believing that confidence will come only after their body reaches a certain standard. They imagine that if they could somehow become bigger, stronger, or more impressive physically, then confidence would naturally follow. But psychological research and sexual health studies often show something surprising. Confidence rarely comes from physical perfection. It comes from understanding and accepting your body as it already is. Think about how confidence actually works. Confidence is not just a feeling that appears automatically when someone meets a specific physical standard. Instead, it develops through knowledge, self-awareness, and comfort with one's own identity. When a person understands how their body works, what is normal, and what truly matters in relationships, the pressure to compare themselves with unrealistic standards begins to fade. One of the biggest obstacles to confidence is constant comparison ***. In today's digital world, people are exposed to carefully curated images, exaggerated stories, and unrealistic portrayals of sexuality. These images can create the illusion that everyone else is somehow more attractive, more capable, or more impressive. But those portrayals rarely reflect everyday reality. When someone measures themselves against those unrealistic images, they may begin to believe they are inadequate, even when they are completely normal. Learning the science behind sexual health can be incredibly empowering. Understanding anatomy, knowing how arousal works, and recognizing the wide range of normal variation in the human body can replace uncertainty with clarity. When people learn that most men fall within a very similar range of size, and that satisfaction depends on far more than physical measurements, it helps shift the focus away from insecurity and toward confidence. Confidence also grows when people focus on overall health and well-being ***. Factors like regular exercise, good sleep, balanced nutrition, and stress management all contribute to better physical and mental health. These habits improve energy levels, mood, and self-image, which naturally influence how someone feels about themselves. When someone feels strong, healthy, and capable in daily life, that sense of well-being often extends into their relationships and intimate experiences. Another key element of confidence is communication ***. Many people assume they must meet certain physical standards in order to be desirable, but real relationships thrive on honesty and openness. When partners communicate about their needs, preferences, and feelings, it builds trust and understanding. That trust creates a supportive environment where both partners can feel comfortable expressing themselves without fear of judgment. Confidence is also closely linked to self-acceptance ***. Accepting your body does not mean ignoring areas where you want to improve your health or well-being. Instead, it means recognizing that your value as a partner and as a person is not defined by a single physical measurement. When someone stops viewing their body as something that needs to be fixed and starts viewing it as something to understand and appreciate, their entire perspective can change. Over time, this mindset shift can transform how someone approaches intimacy and relationships. Instead of focusing on insecurity or comparison, the focus moves toward connection, curiosity, and mutual enjoyment. Confidence built on knowledge, health, and self-acceptance tends to be far more stable than confidence based purely on appearance.